started your timer and here is your question. Right, so if you have read and understood, considering it surgical anatomy station, kindly tell me if you can identify these structures. Can you tell me what 2 is, please? Or what kind of image are you looking at first? Kindly tell me this.
Ma'am, it's an MRI of a brain.
Yes. Which view?
It's
Sagittal.
sagittal view. Sagittal
Yes.
view.
Can you please identify number 2, please?
Ma'am, it's a corpus callosum.
Not exactly. 2 is
It's an artery.
yes. Which artery? And it's a branch.
It's an anterior
of,
cerebral. It's an anterior
yes.
cerebral.
Yes. Good.
Anterior cerebral.
Which is a branch of which vessel?
Which is a branch of middle cerebral artery, which is a branch of internal carotid artery.
All right. Okay. Now, if you can please identify number 14.
It's a middle cerebral artery.
No, fornix. What is fornix? Would you be able to identify all the structures? What is 6, please? Can anyone else tell?
The body of corpus callosum.
Yes, very good. All right. 18.
18 is the rostrum of corpus callosum.
Splenium of, okay. 10. There is 10, yes.
10 is a pons.
Cerebral peduncle of midbrain.
Peduncle.
Okay. 5.
Basilar.
Very good. Which is a branch of or which arises from?
Vertebral artery, ma'am. Vertebral by combination of 2 vertebral arteries.
Right. What is 1 over here? 1.
Anterior arch of Atlas.
Very good. 11.
Spinal cord.
Yes. Okay. And 9. Let's see. Yes. What is 9?
Cerebellum.
Yes. Oh, and 16?
It's a medulla.
Yes. Right. Okay. If you can tell me, what are all the cisterns?
Sorry, ma'am.
Cistern. Can anyone else?
The cisterna magna is the 13, the cerebellomedullary cistern.
Yes. But what is, if you can define cistern?
Cistern is the space that collects the CSF.
Very good.
And it forms a transport process of CSF.
Okay. Can you name few cisterns? One you have identified, 13 was cisterna magna. Any other? Interpeduncular cistern.
Prepontine cistern.
Yes.
Interpeduncular cistern.
Yes. Lamina terminalis. Okay. Can you please tell me what is cerebral vermis and tonsils? No.
Vermis is the connection of 2 cerebellar hemisphere.
Vermis. It's unpaired. Lobes. Yes. And it's the median portion of the cerebellum that connects 2 hemispheres. And Anything else about it?
There are 9 lobes,
Composed of lobules.
Pardon?
Yes,
lobules. Yeah.
very good. Anything else?
These lobules are lingula.
Yes. Vermis, lingula, central lobule, Kuhlmann,
Central.
and many others. You can't tell. Okay. Can you please tell me what is the circulation of cerebrospinal fluid? How is it formed and how is it circulated?
Ma'am, it's formed from arachnoid villi from the lateral ventricles.
Yes.
From lateral ventricle, it will go to from the foramen of Monroe to the third ventricle.
Yes.
And from third ventricle, it is going via the aqueduct of cerebus to the fourth ventricle. And
Yes.
from fourth ventricle, it will go to the spinal cord through 3 openings, foramina magnum in the center, and laterally foramina, lateral
Yeah.
foramina of Luschka. And it goes via the spinal cord, and it will also again absorbed from the arachnoid layer of this spinal cord.
Okay.
And
Can you tell me what are the subarachnoid spaces or cisterns? Can you name few?
subarachnoid spaces. Sorry, ma'am.
Okay. Can you please?
Cistern,
Yes.
peduncular cistern,
Yes.
prepontine cistern.
Very good. Yes. Excellent. Okay. Can you please tell me what is Arnold-Cherry malformation?
Ma'am, Arnold-Cherry malformation is a vascular malformation. Usually
How
it
do you
occurs.
see it on MRI?
Ma'am, it is enhanced image, ma'am, T2.
Okay, but there is more as well. It is downward displacement of cerebral tonsil. And how is it? All right, okay. What is tentorium cerebelli?
Ma'am, tentorium cerebellum, it's a lining which separates cerebral hemispheres from the cerebellum. It is
Okay, can you please tell me what that would be the next one? Okay, right. I wanted to ask you, but then, all right. Okay, if there is a spread of infection into the middle ear, patient will present with meningitis. What will be the features or the signs that you can determine?
ma'am, Kernick sign, ma'am, we can determine
Yes.
Kernick sign by when patient is in the spine position, and we just flex the neck, and he will develop pain because of the meningeal irritation.
Okay, one last question. How would you differentiate between upper motor neuron lesion and low motor neuron lesion of facial palsy?
Ma'am, if I will ask the patient to look upwards, ma'am, if he is able to look upwards with the wrinkles on the forehead, ma'am, it is upper motor neuron lesion.
Yes.
Ma'am, because in the upper motor neuron lesion of the facial nerve, upper part of the forehead, it is spared, while in lower motor neuron lesion, it is lost. So he'll not able to wrinkle his forehead when looking upwards.
Good. Okay, here is the list. Most of those you have recognized and identified correctly, but still you can compare and see. That's, yeah. Good, thank you. Started your timer and here is your question. Right. So if you have read and understood considering its surgical anatomy station, kindly tell me, yes, which area of the organ are you looking at? It's
This is the anterior aspect of the neck.
neck, very good. Can you tell me the neck of a human being is divided into several triangles? Can you tell me how is it done?
There's basically two triangles, anterior and posterior.
Yes.
Anterior is again divided into submental, submandibular, carotid, and muscular
How?
triangle.
Can you tell me the boundaries of anterior triangle?
Submental and submandibular are divided by anterobelly and posterior digastric muscle, and
Yes.
by superior and inferior belly of omohyoid muscle. Omohyoid muscle divided into carotid and muscular triangle.
Yes. And what are
And
how many?
Posterior triangle
Yes.
is divided into
Yes.
posterior triangle is divided into a smaller and one larger occipital triangle and one smaller supraclavicular triangle.
And these
So, I mean
triangles are
subclavian triangle by
Subclavian.
subclavian triangle by inferior belly of omohyoid muscle.
okay. Right. Can you tell me the contents of these triangles?
As a whole, anterior triangle or the subgroups.
Tell me
like
the
in-
contents of carotid triangle, please.
Carotid triangle, there are common carotid artery, internal carotid artery, external carotid artery, internal jugular vein, vagus nerve.
Why muscular triangle is called muscular triangle?
It contains the strap muscles.
Okay. Can you please identify this red vessel 22?
22 is common carotid artery.
Okay. Can you identify this structure here? I think it's 30.
Thyroid cartilage.
Yes. Okay. Can you please tell me what attaches onto the cricoid thyroid? Which membrane? And the
Thyroid
attachment?
membrane.
Okay. Can you tell me the attachment of the vocal cords?
Vocal cords attached anteriorly to thyroid cartilage, posteriorly to arytenoid cartilage,
Yes. And
laterally
laterally too?
laryngeal muscles, and it's medially free.
Yes. Right. How the phonation takes place, which muscles contract, then voice is produced.
Sorry, come again.
How the phonation is produced, how it comes across, how the voice is produced, which muscles contract.
Picothyroid muscles causes tensing of the vocal cords. And
Can you please tell me where would you do a cricothyroidectomy? Where is it done?
The picothyroid membrane, I think it's the second, third tracheal ring. I'm not sure about it.
Okay, can anyone else?
Picothyroid membrane is
Cricothyroid
Okay.
membrane, ma'am. It's
Yes.
done in cricothyroid membrane between the cricoid and thyroid interval of thyroid cartilage.
Okay, good. Can you identify cricothyroid muscle? Can anyone tell me?
6, ma'am.
Sorry?
6.
6. Okay, can you please tell me what is its innervation?
Superior laryngeal nerve.
Very good. Okay. What is foramen cecum? Where is it located?
It is located in the base of the tongue. It is
Yes.
the origin of the thyroid gland during embryonic period.
It
the
descends.
tissue of
Yes. Yes.
tissue from the foramen cecum descends down as a thyroid bud, and it descends in the anterior part of the neck, resulting in the formation of thyroid gland. And later on, it is occluded, but if it is persistent, it can lead to the thyroglossal cyst.
Yes.
Mm.
All right. Okay. If this cyst gets infected, then how
Uh,
does the patient presents?
Patient will present as a continuous discharge from the midline. There's a midline swelling with continuous discharge.
Yes.
So he has a discharge signs in the midline of the neck.
Yes.
And
Can you identify the thyroid gland?
ma'am, it is over the thyroid
16.
cartilage. Six, yes,
16, yeah.
16.
Yeah. Okay. Can you tell me how is it divided? What are the parts of the thyroid gland?
Ma'am, it is divided into
Yeah,
right and
thyroid
left
artery.
lobe with
Yes.
right and left lobe with isthmus.
Yes.
Isthmus corresponds to tracheal ring C4, C5,
Right.
and the
Can
lobes
you
were extending
please
from.
tell me the blood supply of the thyroid gland?
It's supplied by superior. Yeah, ma'am. I will ask. Supplied by superior
Yeah,
thyroid
continue.
artery, which is a
It is a
branch of thyrocervical trunk, which is a branch of a which is a
No,
branch of
ECA.
No.
external carotid, which
Yes.
is a branch of external carotid artery, superior thyroid artery, and inferior
one is
thyroid
branch
artery,
of,
which is a
yes.
branch of thyrocervical trunk. Yes, ma'am.
Yes. And
Ma'am,
the
and
And
sometimes
arteria
thyroid
thyroidea.
artery directly from the arch of artery.
aorta. And the venous drainage quickly
Venous
because
drainage is superior, middle, and inferior
Inferior.
cerebral, inferior thyroid arteries. Superior and middle will drain into the internal jugular artery and internal jugular vein, and vein, yes. And inferior drains into the brachiocephalic
Brachio.
trunk, or yes, or subclavian vein.
Okay. Recurrent laryngeal nerve supplies what?
Recurrent laryngeal nerve supplies the intrinsic muscle
Laryngeal
of
muscle,
Except
except to the
cricothyroid,
which is supplied by?
external
superior
laryngeal.
laryngeal.
Okay. What is the vertebral level of thyroid cartilage, please?
C4.
C45. Okay. Can you please tell me why during swallowing or deglutition thyroid moves?
The thyroid is enclosed in pretracheal fascia, which
Yes.
attaches with the hyoid bone and thyroid cartilage. While deglutition, the digestive muscle contracts, which pull up the hyoid bone and which pulls the thyroid cartilage. So it moves the pretracheal fascia with its contents.
What are the commonly injured nerves during thyroidectomy?
External laryngeal nerve, recurrent laryngeal nerve, and sympathetic nerves, cervical sympathetic nerves.
Okay, Bell has gone, but can you please tell me what is the most common carcinoma of the thyroid,
Most common is the papillary
which
carcinoma.
spreads through lymphatic papillary?
Papillary carcinoma.
Yes. All right. Okay. Yeah. Right. Thank you.
Thank you.
Started your timer, and here is your question. Right, so if you have read and understood considering the history-taking station, kindly begin.
Okay. Hello.
Hello.
Hello. Good afternoon. I'm Dr.
Hello.
Nunjir, one of the surgical exam candidate. Could you please confirm your name and age?
Yes, I am Jen. I'm 7 years old.
Sorry. I can
Jane,
hear.
57 years old.
Yes,
You're Jane. Okay. So is it okay if I call you Mr. Jane?
yes,
Okay. Nice to meet you, Mr. Jane. So can you please tell me what problems bring you here today and how can I help you?
yes, but I have just a bulge over here. Has been started about like 3 months ago. Really troubling.
Sorry, I can hear clearly.
Yes, I have a bulge just over here.
Okay.
It's been started about like 3 months ago.
So, so sorry to hear it, Mr. Chen. I think it is troubling you so much. So, can you
Yeah.
please? So, I want to ask you a few more details about your problem. So, could you please tell me? Did it start suddenly or gradually?
Gradually.
Gradually. Okay. So, is it present only in your left side or also in the right side?
Just on the left side.
Only the left side. Okay, so is it increasing in the size day by day?
Yeah.
Okay,
Come more.
so
Mhm.
okay, so so it is increasing in size day by day. Okay, so do you feel that the swelling is having pulse?
No.
No pulse. There is no ups and down movement, right?
Yes.
Okay. So is it present all the time or some appears and disappear like that?
Just here all of the time.
Okay, it is present all the time. So Mr. Chen, is it associated with any pain?
Yes. There's pain associated with.
Okay, so is it reducible or irreducible?
No, it's irreducible.
Not reducible?
Yes.
Okay, so is there anything that makes your swelling increase in size, like heavy exercise or coughing?
No, doctor.
No. Okay, so is there anything that decrease its size, like lying down?
No, doctor.
Okay, so have you any lumps or bumps in anywhere of your body, any parts of your body?
No.
Okay, so do you feel any fatigueness nowadays?
No, doctor.
Oh, so have you noticed any like any loss of appetite or weight loss?
No, doctor.
So have you taken any injection or have you any stiff trauma at the site?
Yeah, I used to inject myself at this area. Actually, I'm addicted. I use heroin.
Okay, I got it. So have you any fever?
Yes.
Okay, so so have you any? Are you suffering from any chronic cough or have you any problem with your water works or bowel works?
No, doctor.
Okay, so now I want to ask you about your past medical, surgical, drug, and family history. Have you any other past medical illness for that you have to see your GP?
No, doctor.
Have you any history of any surgeries previously?
No.
So are you taking any medication?
Just this heroin. Nothing.
Okay. So I have any of your family member has the similar medical illness?
No, doctor.
No. So have you any allergies to any kind of some drugs?
No.
Okay. So so can I ask you some personal question like what are you doing for your job for your living?
I'm a nurse.
Sorry.
Near.
Okay, so who is at home with you?
I live with my family.
Okay, so have you any history of any drinking alcohol or smoking?
Yeah, I'm a smoker. I just smoke 2
So
to
how
3
many?
packs.
Okay, 2 to 3 packs. Okay, so Mr. Jain, I want to ask you some few more questions which will be very relevant to your history. That is, have you any shortness of breath or palpitation or chest pain?
No, doctor.
Any muscle pain or joint pain you face?
No.
Okay, so now what's your idea and concern about your problem?
I think it's maybe related to the medication that I use to inject myself. Is it
Okay,
related to?
okay, well then, so what are you expecting from us to do for you immediately?
Just treat me, nothing more.
Okay,
Can you
basically,
present your history now, please?
so yes, ma'am. So my patient named Jane, 57 years of old, is suffering from a swelling in her left flank, which for 3 months, and it is increasing day by day. It is not pulsatile, and it is not pulsatile, and he has history of fever. It is associated with fever and pain, and
So what is your provisional diagnosis?
yeah, considering his complaint, my professional diagnosis is infected aneurysm.
Okay. How would you confirm your diagnosis? What investigations would you ask for?
So first of all, after doing full clinical examination, I will do duplex ultrasonography, and then I can do CT angiography.
What are the treatment options that you can offer here? Offer this
Yes, ma'am. First of treatment options are surgical, like ligation of the involved vessel, and then revascularization, delayed revascularization.
Can you tell me what is the definition of true aneurysm?
True aneurysm, the aneurysm which contain all the layers of blood vessel is called true aneurysm.
What are the layers of aneurysm? Can you name them, please?
Yes, ma'am. It is tunica externa, tunica media, and tunica interna.
Very good. Can you define pseudoaneurysm, please?
Pseudoaneurysm, pseudoaneurysm is that which do not have all the 3 layers of blood vessel.
Yes. How does it develop? Can you tell me the mechanism?
It may be developed after trauma, trivial trauma, or maybe after taking any trauma or injection to the vessel.
Yes. Just close your eyes and imagine and tell me in this condition when there is pseudoaneurysm, okay, because of trauma it has occurred. Now blood is being accumulated in which 2 layers?
Yes.
Tunica
Which two?
media and tunica
Tunica
adventitia.
media, tunica adventitia. Yes,
Yeah.
ma'am.
Yeah.
Yes, ma'am.
Right. So what was the non-operative management that you can offer?
So non-operative endovascular,
Duplex
endovascular
ultrasound guided compression and percutaneous thrombin injection.
Sorry, ma'am. Can you please repeat it for me?
Yes, the non-operative management that you can offer is duplex ultrasound guided compression or the percutaneous thrombin injection.
Okay, ma'am.
Thank you.
Thank you, ma'am.
Yes.
Started the timer and here is the question. Right. So if you have read and understood considering its surgical pathology station, kindly tell me what is the pathogenesis behind this patient's condition?
Considering this study, I think we are having a problem with pathological fracture.
Okay. How do the, can you define pathological fractures first?
Where this bone got fractured with trivial trauma and
Yes.
or with a pre-existing pathological lesions like some malignancies or osteomyelitis,
Okay.
so that bone get fractured in mild trauma.
Yes. Can you please tell me? Yes. I want to what was the question? I forgot altogether. Okay. How? All right. Okay. What are the conditions which can result in pathological fractures?
Yes, this malignant lesions like Behçet's
Yes.
disease and multiple myelomas and some
Yes.
infective causes osteomyelitis.
Okay. If you
Yeah,
consider osteomyelitis, so what is the most common organism causing it?
Most common organisms is Staphylococcus aureus,
Yes.
Streptococcus pyogenes, and depending on the age, there is these organisms are divided, and there are gram positives, gram negatives, and some other organisms. Most common is Staphylococcus aureus.
Yes. Okay. Considering if it's a pathological fracture, can you please tell me how would pathological fracture appear on X-ray?
Uh,
Can you?
Hypo-
Yes. Can you,
Hypodense shadow.
okay. Can you help me to read this X-ray? Not necessarily of the same patient, but it's taken from Google. If you can see, what can you see here?
It's a anteroposterior view of right lower limb ankle joint, showing tibia and fibula with this talus. There is
Okay.
hypodense shadow.
Yes.
I'm sorry, hyperdense shadow in the tibia.
Hyperdense. Yes.
So it might
What
be
are the conditions that can present like this?
it's sclerotic bone lesions,
Okay.
multiple myeloma, bone osteosarcoma.
Could be. Yes. All right. Can you also,
Osteoblastoma.
okay, if there is a hypodense lesion, how would that present or how would that appear on X-ray? And what are the conditions which causes hypodense lesions?
Hypodense lesions will be osteomyelitis. There will be hypodense lesion,
Yes.
and in case of multiple myeloma, only multiple myelomas of hypodense lesion,
Okay.
hypodense shadow.
If there is a malignancy which presents which presents distally, how would those lesions be, or how would they appear?
Malignant lesion.
Yes. Distally metastasized.
Yes, that will be hypertense.
Yes. Okay, good. You've already told me of your myelitis. Now I want to ask you, okay, you've told me the causes, you've told me the pathological fractures. Okay, how could pathological fractures be managed?
Okay, this will depend upon the causes, and this
And
will And
Yes.
we will take proper history,
Okay,
clinical
causes, wait,
examinations.
and where pathological fracture takes place. If it's in the long bones or if it's in the arms or wherever, you know, that also depends. And the,
Yes, yes.
yeah. And
There
then
is
what
one
are the,
medial,
yes,
medial scoring system. What is that system?
okay. Can you please tell me what are the primary sites where these metastasis takes place for the most common carcinomas?
Yeah, prostate, breast, lungs, kidney,
Thyroid, kidney, yes,
thyroid.
yes. Can you tell me if you don't get to manage the patient with thyroid, with the with the what are these pathological fractures? I'm sorry. So, what are the complications that can arise?
Complications of pathological fracture.
Pathological fractures, yes.
Yes, there will be deformity, malunion,
All right. Delayed union or malunion. Okay.
abscess formation, and
Yes.
that will dislodge distant site.
Yes. Good. All right. Fixation. All right. Yeah, that was the question actually. How would you manage the pathological fracture, and then depending upon the condition as well. What would be the best investigation modality to confirm the diagnosis of pathological fracture? Does it have to be only X-ray? Or
No, we can do
blood?
bone biopsy,
Okay, anything else?
bone scan, PET scan.
Yes. Is there any role of FNAC?
FNAC,
If this thyroid carcinoma, they say if they have to
yes.
differentiate between adenoma and carcinoma, then maybe they can go ahead with it. All right, okay. Right. Mostly the squamous cell carcinomas, they develop and they form a sinus as well. Do you know why?
Squamous cell carcinomas produce sinuses. No.
Can you tell me the pathogenesis of osteomyelitis in the steps?
Osteomyelitis,
Yes,
there will be inflammation, and there will be the microorganisms will go into the site that will trigger the acute inflammation. There will
yes.
be leukocyte infiltration,
Suppression, yes,
fluid exudation, and there will be swelling. There will be increased pressure in the bone, that is interosseous pressure will be increased, and
yes,
that will lead to severe pain.
yes,
And then there will be formation of abscess.
yes,
This abscess formation occurs in underneath the periosteum, that is called subperiosteal abscess. And this abscess can get resolved, or it can go pass along the periosteum, and then there will be formation of sequestration due to
or
necrosis of
resolution,
bone.
yes, yes,
And around the sequestrum, there will be formation of new bones from the periosteum, which are called involucrum. Those are periosteal new bone formation.
and at the end there is resolution. Good. Okay, thank you.
Thank you.